Anyway, we want to welcome everybody to the monthly African American Network Buffalo Soldiers podcast today. And we want to welcome our special guests with us today, Mr. Juan Avila, who is the Chief Operating Officer at Garden Pathways, and Ms. Erika Morrison, who is a mentoring specialist at Garden Pathways here in the city of Bakersfield, California. We also want to welcome with us today our Buffalo Soldiers panel, Lieutenant General Slade, Major General W.A. Slade. I'm Brigadier General Isaac Sandifer. And we also have with us Brigadier General Charles Everly. And I see joining us First Lieutenant Brian Bowens, Dr. Brian Bowens, who's with us today. So welcome to all of you. And we're glad that everyone is here today. And as I said, this is our monthly podcast that we do, sponsored by the African American Network of Kern County and the Buffalo Soldiers. And our aim on these podcasts is to simply educate, provide information, share information, with those who will be viewing this podcast and nationwide. And so we're glad to have each of you here today. I'll be the moderator today for our podcast, and all of you should have by now received a copy of the podcast platform. I'm going to review it for our benefit today. Our discussion topic is Medi Cal Expansion in California, and that seemingly has become a pretty hot topic. And in 2024, there will be expanded Medi Cal coverage. There will be more services and more coverages available to an expanded constituency of residents in the state of California. We will have today an informational discussion with questions and answers about the state's mandate of Medi Cal expansion of coverage. Our guests today, again, are Mr. Juan Avila, the Chief Operating Officer, and also Erika Morrison, who is a mentoring specialist, both at Garden Pathways here in Bakersfield. And they will share information with us about the expansion of Medi Cal, who's covered, the expansion of services and benefits, transformation of public health care, underserved communities, eligibility requirements, new services, and perhaps some other things that they will share with us today. So we're going to open it up with Mr. Juan Avila to talk about this, and then also with Erika Morrison, where you can also share with us information along these lines on our platform. Mr. Avila.
Yeah, good afternoon, everybody. Thank you so much for having us here today to share a little bit about Medi Cal and possibly a little bit about what role Garden Pathways plays in this field or in this work. So again, my name is Juan Avila, and I've been serving in Garden Pathways for a little bit over 11 years now. And our mission is to transform lives from the inside out through loving, mentoring relationships. We are a mentoring agency that provides mentoring to some of our most marginalized individuals or hardly reached individuals, as we like to say. I'd like to start off to saying that we are in no way experts in Medi Cal. And back in 2017, we decided to get into the work of making healthcare accessible to the people we serve. And I'll start off with a story of a gentleman by the name of Curtis. And this individual, chronically homeless, he was living out in the parks, had his bicycle. That was his most prized possession, but definitely was living out in the elements. And he came in, he had previous incarceration, and he came in for services, wanting to get back on his feet and become employed. Through mentoring, through some cognitive behavioral therapy groups, through employment strategies and job navigation, we were able to start working with him. And we worked on his resume, we worked on interviewing skills. We went to a job fair at what was then Rabobank Arena. It's now Mechanics Bank Arena. And we're walking around and he's sharing and he's giving his resume, and we stop at a place called KSI. And it's an oil industry contractor. And he walked to the front and he gave an individual his resume. The individual that worked at KSI looked at it and saw that he had in the past heavy equipment operation experience. And he said, "You have heavy equipment operation experience?" And Curtis said, "Yes, I do, sir." He's like, "You know what? Let me give you my own personal card. I need you to give me a call. Let's set up an interview." So he calls him, sets up the interview. We go and we get Curtis some clothing for his interview. We get him a haircut, and he rides his bike all the way to KSI on James Road for his interview. He comes back and he says that he's really excited. His interview was in a pickup truck. They drove him over to the fields and they said, "You see that backhoe there?" He goes, "Dig me a 6-foot trench." Curtis said, "Okay," gets off, gets in the backhoe and digs a 6-foot trench. He says, "There you go, sir." And he says, "Okay, now fill it up." And he goes out and he gets in the backhoe and he starts to fill up the 6-foot trench. He goes, "Okay, well done. You do know what you're doing." They drive back to the office and the gentleman comes with a big packet and says, "You know what? You're hired. You know, you're conditionally hired. Here's your packet so that you can fill it out." And one of those forms was a form to see the company doctor so that he can get his physical clearance. So Curtis goes to the doctor and the doctor tells him, "I cannot clear you. You have a herniated belly button," which if he had health care or health insurance, he would have been able to treat it before going and applying for the job. The employer said, "We'll hold your job for 30 days. Go get it taken care of." And Curtis didn't have health insurance and he didn't have Medi Cal. And we started the enrollment process. And back in 2017, it took about 6 months before somebody can actually get their Medi Cal activated. So the gentleman, so Curtis ended up losing the job, losing the opportunity, and he spiraled back into alcoholism and into homelessness. And that's when, for Garden Pathways, we said, you know what? We need to make sure that individuals have access to healthcare so that they can make sure that they're healthy when they're going into the workforce, or they're going to improve their quality of life through any other opportunities. And so that's why we're really excited with 2024 as we see the expansion of Medi Cal. And one of the most significant changes that we see in Medi Cal beginning January 1, 2024, is the expansion that provides adults ages 26 to 49 years of age access to full scope Medi Cal despite their immigration status. And that's anyone. And I love what B. Slade said at one of our recent convenings, is that sometimes we focus only on the Latino immigrants, but that we have a wide scope of other immigrants that are going to benefit from this, including single young adults and single young adult males. And so the other thing is that all other Medi-Cal eligibility rules, like income qualifications or limits, will still apply. But now, despite immigration status, they will qualify for full scope Medi-Cal. Now, I know people are asking, well, what is full scope Medi-Cal? So full scope Medi-Cal includes your preventive health, which is your primary care provider, your doctor, dental, vision, hearing, mental health, substance use disorders screenings, substance use disorder services, and then it includes prescriptions, and then transportation for any appointment that you have that is health related. So that's full-blown Medi-Cal, where before they might be eligible for emergency Medi-Cal just to treat the emergency, but then once they're post or once they're discharged, all the other services are not included. And so now it would have been out of pocket. And especially for individuals, this is significant because it's for individuals that usually don't have any trust with institutions, including those that are undocumented. The last thing they're thinking of doing is going into a healthcare facility and expose themselves as being undocumented, if those documents are being required or requested. And so now they can actually be healthy, and especially since they're some of the most hardest workers out there, we can make sure that they are healthy.
Mr. Avila, you mentioned there is an emergency Medi-Cal. The gentleman that you were referring to earlier who lost his job or lost a chance to get a job because of the delay, would he have qualified or been able to get a job, say today, under that emergency Medi-Cal program?
If he would have gotten sick and went into the emergency room, then they would have enrolled him into emergency Medi-Cal. But because it wasn't an emergency, he wasn't in pain. He didn't even realize that he had a herniated belly button. And so I can just imagine living out in the elements and being homeless, that you already have so much pain that you don't know where it's coming from. So but yeah, emergency Medi-Cal, it is a good resource.
Sir, I have a question for you. One of the in that example that you used with that gentleman, there was that time frame in order from when you applied and when it's approved. Is that improved any? You remember you mentioned about the waiting list or the waiting time. Is that improved any with the new, or is that now they got more people? Is it longer or shorter, or is it the same, or what?
Yeah, and so we work with the justice involved population, and back in, I want to say it was 2019, AB 720 was passed, where it allowed us to go inside of the jails and start the application process when they were while they were still incarcerated, if they were going to be released within 6 weeks. And so we would go into Lerdo jail and find out who's going to be released, who really needs health benefits, especially those that need mental health medication. And we'd start the enrollment process. Once they're released, we notify Department of Human Services that the individual's released, and they just hit the approve button. The fastest we got somebody that was released from Lerdo Medi-Cal was an hour and a half. So they came out, they did their paperwork, we called DHS, and in an hour and a half, their Medi-Cal was activated. And that was really important because individuals that are incarcerated that need mental health medication are released with 7 days of medication. And in the past, if it took 6 months, 7 days was not enough. Now they have this mental health need and they're self-medicating. And then here we go again in this spiral of addiction. Mm-hmm. But it is improving. The Department of Human Services has been improving. Now, with the new laws, if somebody's going to be released within 60 days, you can actually enroll somebody while they're in custody, and it'll be active while they're in custody. So by the time they're out, their Medi-Cal is already active.
Let's let Ms. Morrison chime in. And Erika, you are a mentoring specialist there. And can you tell us anything from your perspective and your work that you do?
Yes, absolutely. So as Juan had mentioned, the majority of our population are justice involved individuals who are reentering back into society. I myself was one of those individuals. I'm a former client of Garden Pathways after being incarcerated for a very long period of time. With the new updates and expansion in Medi Cal, and I feel it's more easily accessible for individuals. I was able to come to Garden Pathways. I had no idea how to enroll for Medi Cal on my own. So the mentor that I was working with at the time was able to assist me in that process. We were able to do it there from our offices. Where I had a major fear of going into large public places because growing up, you're going to the medical office, you're there with about hundreds of other people and you're waiting for 6 hours and spending the whole day there. And it was just rather draining, nerve-wracking, a lot of anxiety. And so a lot of those issues were diminished. And for me, being able to have someone assist me in that process. So now I'm able to do that with the individuals that I work with. If there's a need for Medi Cal, I can help enroll them through the Medi Cal website, which is the Cal Benefits login. And excuse me, it's Benefits Cal login. It's very easy to navigate through it. They make it very simple. And I've noticed that for individuals that I have assisted in applying for benefits with, the wait time, the longest that I've ever seen when an individual wait was approximately 3 weeks. I've had individuals approved within 14 days. So as long as they have whatever is required to enroll, a lot of the times they want to see pay stubs or a work history so they can determine income eligibility and things like that. It's even been as simple as, for those who didn't have a work history, to just write a note and say, I have no work history, or I haven't had a job for this X amount of period of time, or never had a job in the past, and sign sort of a attestation where we're able to upload it and just add it to their application. And that was good enough to be able to determine their eligibility based on their income as well.
All right. I have a couple of questions. You mentioned the age parameters, 26 to 49. What does a person do who's 52?
Yes. So this new expansion for 2024 was modeled after Senate Bill 75, which in 2016, it made anybody that was under the age of 19 eligible for full scope Medi-Cal despite of immigration status. In January 1st, 2020, it opened that up for anybody under the age of 26, so extended it to receive full scope Medi-Cal despite immigration status. And in May of 2022, it provided full scope Medi-Cal to adults 50 years and older despite Medi-Cal immigration status. So why this is so significant is because now it covers all ages.
Okay. My second question is, let's say a person moves here from another state and has had public funded insurance in that state. They're relocating to California, Bakersfield or LA. No income, no official place of residency. Could they still qualify for Medi-Cal and do this program?
Do you want to take that one, Erika? Have you had somebody that's
Yes.
come from a different state?
Yes, I actually have experienced that several times. When you're applying, they do have an option to apply for emergency assistance. They have a general assistance for adults who have no income or who may be facing homelessness. And they also have Medi-Cal emergency assistance for individuals who are also facing that same situation. And they even ask the question, are you homeless? Is your food going to run out in some X amount of days? Do you have less than $100 or $150 to your name? That sort of thing, where it does tend to expedite the process. My mother is a disabled senior citizen who went through that. She moved back to California from out of state, and she had to apply for benefits out here. And it was a very easy process, and they were very eager to help her get her benefits started and in a speedy manner as well.
So therefore, should a person go to the Department of Social Services on California Avenue, or could they come to Garden Pathways to apply?
Yeah, they can definitely come to Garden Pathways to apply. We don't have the same capacity as the Department of Human Services down on California Avenue, but if somebody's concerned about going to such a big institution, they can definitely come to Garden Pathways. If we can't help them, let's say their Medi-Cal is a little bit more complex, we can always connect them with some other partners that do Medi-Cal enrollments. And so we have the Dolores Huerta Foundation that does it, Clinica Sierra Vista, CAP-K. So we have quite a few navigators. But that's the other important thing, is that they're allowing navigators that are community-based to help with these enrollments. So it doesn't have to be a government entity or department. We can definitely use people from the neighborhoods and the communities to be those advocates to help individuals access healthcare.
Yeah, yeah. And I hope I'm not putting you on the spot. I'm asking these questions on behalf of an individual who just moved to California. If let's say they're having some difficulties navigating through DHS, could they possibly refer to you?
Yeah, absolutely. If you have somebody, our partners will always refer somebody that say, no, you know what, Garden Pathways will take care of you. Send them our way, and we would be more than happy to help them navigate the Department of Human Services services.
And should they, if they are referred there, ask for?
They can ask for me, or they can ask for Erika, since we're connected to you all. And then we can connect them to the right person. We have about 48 mentors here at Garden Pathways that can help somebody with a lot of their needs.
Okay. One more question. Underserved communities. How would you define underserved communities?
Yeah, and so for us at Garden Pathways, the underserved communities are those that are hardly reached. And so our mission doesn't specifically state who we serve, right? Transforming lives from the inside out through loving mentoring relationships. And when I started back in 2013 with Garden Pathways, one of the things that we noticed, especially with the AB 109 and the prison realignments and the changing in legislation, we saw that those that were kind of being left behind were those that were formerly incarcerated, those that were being released from incarceration. And then they were becoming the scapegoats of a lot of the social issues that we were seeing in our communities. The increase in homelessness, oh, well, they're all the people that were released from prison. The increase in crime, oh, well, it's all the people that were released from prison. And so for us, that was an underserved community. We wanted to work with those individuals. The other underserved communities are those communities that tend to be forgotten by our elected officials. And so neighborhoods that are high crime, high poverty, those are the communities that we want to target on our end. And then those that are at the highest risk of being victims or the drivers of community violence. Not all of them are, but some of them are gang members, and they tend to be also not reached. And there's an opportunity there to connect with those individuals. One of the most interesting things with Medi Cal Expansion is this whole Cal-AIM program, which is California Advancing and Innovation Medi-Cal. It's a program under Medi-Cal that will eventually make community violence intervention services Medi-Cal billable. And that's significant because those that are at the highest risk of community violence are usually our Black and brown young adults.
Okay. And one other question came to my head. I don't mean to take up all the time from everybody,
no,
but the services, are there any real new services that are added here in 2024 that were not on the books in 2023 or 2022?
So when we look at 2024, I would say one of the newest services that I've actually seen is this whole pre-release and expansion of coverage 90 days prior to release. It hasn't gone into effect. It hasn't been fully implemented, but it looks like 2024 there's going to be a bigger effort to start expanding coverage to those individuals that are currently incarcerated. It will have to be Lerdo because those are all of our Kern County residents, as opposed to the state institutions. There's a different process for that. Even though we have the most state prisons in Kern County than any other county, 10% of the population is Kern County residents. The rest of them are from other counties. So that's one change in service. The other thing is that now they're covering doulas. And so doulas are those birth educators and those birth supporters. And when we look at in infant health concerns, we see a lot of our Black and browns having those birthing concerns, right? And you have those high risk births. But the research shows that when you provide somebody with a doula or a health birth educator, somebody that's going to be there to support them and advocate for the patient, that the birth rates improve. And in the past, only those that were wealthy could afford a doula, and they would get a doula for themselves. But now doulas are going to be covered by Medi Cal. And it's interesting because doula work is very indigenous work, and that our indigenous populations can't afford it. But now that's going to be a service that's going to be provided by Medi Cal. And then the violence intervention and prevention work. So when somebody is a victim of community violence and they're in the hospital, a victim advocate will be covered by Medi Cal to help them during that time.
Also, if I may, so starting in 2024, this year, as of January 1st, all of Medi Cal, it used to be HealthNet and Kern Family. They've done away with HealthNet, and whomever had HealthNet transition and is now covered under Kern Family Healthcare. And their program is really neat. They offer a lot of incentives for individuals who enroll. One of the things that they're doing is they're actually now giving out gift cards for individuals who complete certain health checkups. So if you have your first annual checkup within, I want to say it's 60 days, don't quote me on that exact amount of days, it could be 90. They're going to send you a $25 gift card. I have a 5-month-old son, and for each one of his checkups where he is immunized, or a baby wellness checkup, they also send gift cards out as well. Their website is very easily accessible. If you lose your card, you can just quickly go on the Kern Family Healthcare website. They'll have a digital one. You can print one out. And then you can just call them. It's so easy to call them and speak to somebody, whereas in the past, it's almost nearly impossible to get someone on the phone at the Department of Human Services, or they've made it much more easy and accessible for individuals, and have offered some really nice perks and incentives for those who are receiving Medi-Cal through them.
All right. Any other questions? I mean, from anyone on our panel?
Yeah,
I'd just like to say thank you to the generals that have produced this podcast, and to Mr. Avila. We go way back since the beginning of the African American Network. And Miss Erika, thank you so much for last minute. We met a month ago, and thank you for coming and letting us know about all the new incentives that are part of the Medicare 2024. And I'm excited that we are continuing to partner with Garden Pathway, because we've had some of your clients that we've mentored to in past years. So we are not new partners, nor is Garden Pathway new to the African American Network, Buffalo Soldiers. And as a Lieutenant General and the president of the African American Network, this partnership will continue. And the referrals from us will continue, because together, unity, we will all continue to improve our community, not make it better, but to improve it, and to make certain that every resident has an opportunity to be the best citizen that he or she desires, not what we desire, but what they desire, and have the best of help to help them in making those decisions. So thank you, Ms. Erika. You are definitely a model and an example of what you can do when you set your mind to it. You're an example of the mission statement of the Buffalo Soldiers, moving people from where they are to where they need to be. So I thank you.
Thank you very much. It's been an honor and a pleasure to be here. I'm looking forward to continue to partner with you all, and thank you very much.
And Mr. Avila and also Erika Morrison, do you both find that your clientele base has grown or will grow more in 2024 than in the past?
Because of the population that we serve, I hope it actually shrinks. I hope, we reduce recidivism.
Okay.
But I hope that we can now start working with the younger population and give them hope. I think a lot of the issues come from a state of desperation. People have to feed their families, people have to diaper their babies, people have to take on responsibilities, and when opportunity is not provided to them, then they have to do it by any means necessary. And sometimes that leads to poor decision making and poor outcomes. And so we hope that we are able to provide those opportunities through partnerships and collaboration. But I do definitely see that our numbers will possibly increase in 2024 because we will be expanding into other areas as well.
Okay, great. Well, any other questions, ladies and gentlemen? I see Ms. Trista Carter has joined us. Ms. Carter, you have a question or comment?
While she's thinking about that, I see Dr. Bowens has raised his hand.
Okay, I didn't see Dr. Bowens. Yes, go ahead.
Thank you. It's a black hand, but thank you. Yes, Juan, quick question. You said something about helping out the younger generation, younger. As an educator for the past 15 years, what does that look like? Is Garden Pathways going to partner up with the school districts? What would that look like? Because as an educator, as well as some of my residents from Brenda Jeans, I'm the executive director of Brenda Jeans. We're in the same line of work. I'm new to the game, 9 years now. They go to Garden Pathways. But what I'm getting at is I'm at the point where I have my mother and myself have seen classmates that we went to school with in our facility, in the streets. I'm getting real close to being where my previous students I see in the streets. So can you elaborate, how is Garden Pathways going to position themselves to help out the younger people who are struggling with, whether it's be substance abuse, mental health, because even the current high school district has substance abuse counselors. Even Panama Buena Vista would go up to 8th grade. We have kids at my site. I'm the lead health official on my campus, and they deal with drug abuse. We have a lot of kids and drugs. So my question is, how is Garden Pathways going to help the youth?
Yeah, no, thank you for the question, Dr. Bowens. In our scope of work, there's always intervention and then there's prevention. When we have our stakeholders and they provide an investment, most of the time they want to see a quick turnaround. And a quick turnaround is working with the highest risk individuals and providing intervention to those individuals. And you'll see an impact and you'll see change within a year to 3 years. But then prevention usually takes anywhere between 6 to 10 years to see the effects and the impacts of prevention. That's why funders get frustrated when people provide prevention services. So going and working with the youngsters would be the preventive piece on our end. But it goes beyond. It goes into trying to develop solutions through collaboration and partnerships and strategic coordination of services and resources. And so there was a time, I'll give an example. There was a time, I want to say it was in 2017, where the current high school district was going through litigation for disproportionality of suspensions and expulsions. On our end as Garden Pathways, we were already champions of trauma-informed care, trauma-informed approaches. We are already champions of the ACEs study, and to first work with the trauma and navigate the trauma, and asking those questions of, instead of saying what's wrong with you, what's happened to you, and how does that continue to affect you today? And so how can we connect you with resources to kind of help you process through that trauma, and also connect you to resources to address the immediate basic needs? And so we went to the current high school district and said, you know what, we're not here to, point our finger at you and tell you, bad boy, but we would like to figure out how do we come together and figure out solutions. And so instead of suspending and expelling a student, what if we came and provided mentoring? And we asked them, we said, you know what, but we don't want an after school program, and we don't want a program during lunch. You need to invest one period a week where we bring those kids that are at risk of being suspended or expelled. And as an alternative, they're going to come for mentoring. And we'll mentor them. And now they have a choice. They know, look, we want to make sure that we navigate through whatever you're going through. And it's been pretty successful because these kids are not getting suspended or expelled. Attendance improves, GPA improves. On our end, we feel if they go from a 0.5 to a 0.75, that's for celebration on our end. We celebrate those milestones. But we also feel that if somebody is mentally, physically, emotionally, and spiritually healthy, that the grades and the attendance are going to take care of themselves. And so because of that, because of the success that we've had in the high schools, we've expanded into some of the middle schools, and now we're going into the elementary schools. We love the fact that schools are implementing the multi-tier systems of supports, having different level of resources for tier 1, tier 2s, and tier 3 students. We love that they have social workers on campus. We love that they have the substance abuse providers on campus as well, especially at the high school districts. But the school districts, in working together with us, they've also learned the value of working with individuals that have credibility in the neighborhoods where kids are most impacted, and they go to these environments where there's high crime, high violence, high substance abuse, high poverty. And especially sometimes we do utilize individuals that have lived experiences that go and also meet with the parents and do home visits, and then also work during school breaks, because a lot of the services at the schools will work during the school's in session, but then there's a winter break and then there's a summer break. So we try to bridge that so that these kids are not left alone during those times, and still connect them with resources when they need it. But also knowing that there's other providers out there. We have the Wendell Davis Foundation that provides services. We have Stay Focused Ministries and Reach for Greatness that provide services. But we all have to work together and collaborate to make sure that we're not duplicating, but we're being intentional in achieving certain outcomes.
Okay. All right. Okay. Anyone else before we work to wrap it up?
Another question. What schools are you in? I know I worked with Wendell. I worked with you too. We go to those meetings together. The BSS, what P?
Yeah.
Yeah, we go there. Yeah. You helped me out and during COVID time. So what schools? Because I work with in the African American Network of Kern County, Buffalo Soldiers. We work with all the schools. And if you talk about the Kern High School District, I work with every site. So what schools are you in?
Yeah, so the Kern High School District tends to identify the schools that they want to see us in. There's some schools that just don't want to give us a school period, but
yeah,
we are south, north, east, west, Miramonte, Arvin, east. I already said east. Miramonte and Arvin. We're in Wallace Middle School over in Lake Isabella.
Okay.
We are Emerson, McKinley, MLK, and Stella Hills, Sierra Middle School, and then in regards to youngsters, we're also inside of Camp Owens, Apex, Crossroads, and the youth detention centers.
Okay, what about Betsy Owens and Fremont Elementary?
Yeah, so we're not, man, Fremont, that's my alma mater. So as soon as BCSD says, hey, you know what, we need you to go to Fremont, I'm there. But absolutely, Bessie Owens, Fremont, those are all schools that need additional resources. And
Also
I'm definitely gonna be
Casaloma
pushing
too.
for it.
Casaloma.
Casaloma, absolutely, yeah.
Okay.
All right. Okay, well, Mr. Avila, want to commend you for your work. You and Erika Morrison, commend the both of you for your work. And we appreciate each of you being on with us today. You provided a wealth of information to us, and also it will be a wealth of information to others who will view this podcast here in Kern County. So we really want to thank both of you for taking out your time, for being with us today. We appreciate what you do. And if by chance you see me dropping by your office, perhaps with someone who I want to recommend, I will ask for either one of you. Is that good?
Absolutely.
Absolutely.
All right.
Thank you.
All right. And thank the Buffalo Soldiers, all of you, for your support, your work in putting together this podcast. We appreciate each and every one of you. And I'll say to you, have a good rest of the weekend and a good week next week.
Absolutely.
Take care, everybody.
Thank you all. Take
Thank you,
care.
everyone.
Thank
Thank
you.
you, General.
Appreciate it.
Thank you.